Thank you for everyone for taking time out of your busy schedules to come to this education session for our health insurance. I'm happy to introduce Meredith Roy, who's our wellness coordinator with New Hampshire Interlocal Trust, and with her is Rick Jones, who's the deputy administrator of the trust. They're here to share information with us that will help us to be better consumers. We're going to learn a few things, and I'm happy to have them take over.
Thanks, Vicki. I'm going to get started by talking a little bit about the Affordable Care Act and how it affects you guys. And so the Affordable Care Act is also known as health reform. Sometimes you'll see it called ACA, sometimes you'll see it called PPAC, Patient Protection and Affordable Care Act. But they're all the same thing. It's a law that was passed in 2010, and each year more and more pieces of it have been taking effect step by step. It includes a requirement that you have coverage starting this year, and also requirements that your employer offers coverage. And there's a lot of major changes to benefits taking place as well. So we're going to take a quick look at which parts affect you as employees. First, the benefits have changed. You've probably noticed over the last couple of years a steady series of changes to your benefits. First, on all health plans now, preventative care is covered at 100%. And there's a government panel that decides what qualifies as preventive care and how frequently. And if it's on that list, which is a very large list, it's now just free. There's no deductible, no copay. So that's an improvement in benefits you've got, and it's whatever health plan you're on in the country. Second, there's no more maximum annual benefits. Some plans used to have a limit of, say, $1 million or $2 million for what your total benefit could be in a year, and that's gone away. While I hope you never need for that to matter in your life, we do have people where it does. So, also, lifetime limits were eliminated. So if you had a plan that had $2 million lifetime limit to benefits, now it's unlimited. So you don't have to worry that because you have cancer or a really sick kid that they'll somehow go over that limit. Also, there used to be annual dollar maximums inside of plans. For example, a lot of plans in New Hampshire had a $5,000 limit on durable medical equipment, things like wheelchairs, but any dollar limit inside health plans has now been eliminated. So you might still find some per visit maximums, like 40 visits to a chiropractor or something, but you won't find any dollar maximums in plans. And that's also true with mental health and substance abuse, which used to be the most common places there were these limits. So if working here drives you crazy, the good news is you can now afford treatment. And in general, mental health benefits are now treated on a par with regular other medical conditions as well. Plans have to cover something the government calls minimum essential benefits, which I will often refer to as being good enough. A plan has to be good enough to satisfy the government standard. And all the plans the city offers for its employees meet that standard. Another change going on is there's a bunch of new costs in your premiums, taxes and fees, and one of the reasons your premiums have been going up more than they otherwise would have recently is these have had to be added in. The first, the government thought when they were passing health reform, there's all these different ways people practice medicine, and they can't all be right. One of them must be better than some of the others. So they're collecting $2 for every man, woman, and child on the health plan every year to fund research studies to decide which way of treating you for health care is better. And hopefully good things come out of that. But that's $2 for you and everybody in your family each year. Then there's a reinsurance fee. The idea here is there are responsible employers that pay for their health insurance for all their employees, and then there's ones that don't pay for health insurance that are going to need to go to the exchange and buy health care there. So rather than tax the irresponsible employers and have them pay for this, they're taxing the responsible employers $63, again, for every man, woman, and child on the plan a year, and that money goes to help pay costs in the exchange. So it's kind of a little shuffling. If you pay for health insurance, you end up paying more to pay for the others. Then there's a health insurer tax. It's a little different from insurer to insurer, but it's about 2.5% of the total premium that gets added on the top. Now the good news is the New Hampshire Interlocal Trust is a nonprofit trust, and we are exempt from that, so you are not paying this 2.5% tax, but if you got your insurance from a private insurance company, rates would have to go up 2.5% just for that one tax. Of all the things in health reform, it's clear that people writing the law like tanning salons the least. Now, obviously, there's problems with skin cancer and other stuff from abusing these things. So there's a 10% tax on tanning salons. So they're not too happy about it, but that's the way it is. Also, medical devices, everything from syringes to wheelchairs, have a 2.3% tax on them. And if you follow the news, the medical device makers claim 50,000 people have been thrown out of jobs by this, and they're going to have to stop making wheelchairs and all this stuff because a 2.3% tax is driving them out of business, which is a fascinating argument. I'm not sure I completely buy it, but the tax is there and it is real. And then we're going to come back and talk about the Cadillac plan tax. This starts in 4 years in 2018, but is a very big challenge for groups like yourselves, so we'll have a couple slides on it later. As an individual, and the individuals in your family, this year, 2014, you are required to have health insurance. Now, the exact date has been a little fuzzy. It was January 1st, then it was February, and then it was March, and then it was the end of March, but you're now at the point where you are supposed to have health insurance. Or you'll end up paying a penalty tax when you do your taxes next April. If anybody had fun getting them in yesterday, just wait till next year when you have to prove you had health insurance. Now, the tax isn't too bad in the first year. For 2014, it's $95 or 1% of your household income. Now, if you make minimum wage and work more than about 20 hours a week, it's going to be 1% of your income because $95 assumes you don't make very much money at all for a whole year. And you'd be eligible for Medicaid and wouldn't pay it either. So 1% of your household income, not just yours, but if you have a spouse or something that gets added in. In 2015, it'll be 2% of income, and years after that, it's 2.5% of income, or about $700 minimum. So that's kind of the stick where they're trying to get you to buy health insurance. Obviously, you have options here at the city that may be more affordable than others, but every individual is required to have health insurance. And there are now health exchanges that are happy to sell it to you. The health exchange in New Hampshire only works with Blue Cross, and there's a very limited selection of hospitals that you can go to if you're on that plan, but the plans are available. So the health exchange job is to approve plans and sell those, publish all sorts of standard information so it's easy to compare, not that we have many comparisons here in New Hampshire. And they have to run a call center to answer any consumer questions. They have to decide who's eligible for coverage, who's exempt, who would have penalties, who gets subsidies. And then the part the government tripped themselves up on, they have to build a computer system that interacts with all sorts of different services. It has to work with Medicaid, it has to work with the employees, the employers, the IRS. It even has to work with immigration naturalization because they have to figure out if you're a citizen and here legally, what your income was and so forth. And if you qualify, there are subsidies available up to 4 times the poverty level. And so that means if you are a family of 4, if your income is up to $95,400 this year, you could be eligible for subsidy. And if it's up to about $63,000, if it's just you and a spouse or a child, 2 of you, that's the level at which you'd be eligible for some level of subsidy. So a significant portion of the population is potentially eligible for a subsidy, though we'll cover why you guys may not be in a little while. So these are the premiums state by state, and you can see they're very different. The red states are the highest, the blue states are the lowest. We're a green state. And if you happen to be 27 years old and you get the silver plan, which is the bronze is the lowest, then the silver, the gold, and the platinum. And for comparison purposes, the health plan at the city of Keene would be platinum or platinum plus is how I would describe it. So the silver is quite a drop down from your current coverage. And the rates change with age, but if you happen to be 27 years old, for $360, you could get the silver plan this year in the state of New Hampshire. And it varies anywhere from $192 in Minnesota up to $516 in Wyoming. and it varies with a whole bunch of different reasons, including the health of the population and the way that doctors practice medicine.
Is that per month or year?
That is per month, yep, yep. And if you look at that, you'll say, well, that's less than we pay for coverage here, and there's two good reasons for that. One is, this is for a much younger person on average than the city's population, and the other is, it's for a much lower level of benefit. Plans like this typically have deductibles of like $4,000 or $5,000. So the employers were also told they had to offer health insurance. So we're going to talk a little bit about what employers are required to do so you have an understanding of that. First, they have to provide coverage that meets two tests. It has to be good enough and it has to be affordable. Both of those, of course, as defined by the law. So, and they have to offer that to all employees that average at least 30 or more hours over the course of an entire year. So if you're part-time and you happen to work overtime 1 week and you go to 40 hours, that's not really going to make much difference. But if you're part-time and you average 32 hours a week, you're going to be on this list of people who are supposed to be offered health insurance. Now originally, this was supposed to happen at the beginning of 2014. However, like a lot of other things, there have been some delays. So the current set of delays says that the city of Keene, based on their size, needs to cover 70% of their, needs to offer coverage to 70% of their eligible employees by next July 1st in 2015, and to 95% by July 1st in 2016. So my suspicion is that, like most public sector groups in New Hampshire, they're well over 70% already, and they'll just have to make sure they have it tight to get to the 95%. Employer coverage test. So what is a good enough plan? Well, first, it has to cover at least 60% of total costs. If you think about that, if you had a heart attack and the bill was $100,000 and you only got a bill for $40,000, that wouldn't be that bad, right? That's not actually how they do it. What they've said is there are out-of-pocket maximums, and it's indexed, but it's $6,250 in a single plan, $12,500 in a family plan this year. And they're saying it has to be 60% of the overall cost for everybody in the plan. So some people never have any health costs. They're just perfectly healthy. In the drive over here, Meredith was tempting fate and telling me she hasn't been sick in over a year. So we'll see how that works out for her.
And then I sneezed twice.
But then there's other people who are chronically ill, and they won't pay more than this amount, and it has to average out at 60% or better. Most cities in New Hampshire, when we run reports and look at that, their plans pay between somewhere 94 to 96% of all of the costs in the plan, and I suspect yours are over 90% of the total as well. So this minimum coverage level is well below what public sector employees expect in New Hampshire, but it's what the law requires. So almost all health plans out there meet the standard. When you heard about these plans being canceled last fall, it's because they don't meet these standards. And all of our health plans in New Hampshire Interlocal Trust exceed the standard by quite a bit. So the employers must offer, i.e. you don't have to take coverage, but they have to offer coverage to all employees and all their dependents. And who's a dependent turns out to be a fascinating question. For purposes of the health reform law only, don't go home and tell your spouse this is the deal, because this is only for health reform. For purpose of health reform, children are dependents. Pretty much nobody else. So your spouse is not a dependent and does not need to be offered health insurance. Stepchildren aren't, foster children aren't, and if you happen to have had a very interesting life and you have children that are overseas and not US citizens, the employer doesn't have to offer them coverage either. But from Canada or Mexico, they do. It does not matter if you take the coverage. The employer's obligation is to offer you a plan that's good enough and affordable. The affordability test, the law was pretty unworkable. It said an employer had to figure out what your household income was and make sure a single, two-person or family plan was affordable. Now, how many of you are eager to share your spouse's and anybody else in your household's income with your employer? The only people who ever are willing to tell me what it is, they say something like, not enough. So the IRS had a problem with this too. So the regulations are very different than the law. The regulations say that the employee's cost for the premium, kind of like your payroll deduction, can't be more than 9.5% of your salary for the year for the least expensive plan that qualifies. So if the city offers you a choice of more than one plan, the least expensive one is the one we would use to calculate affordability. You can take a more expensive one, but it doesn't figure in the calculation. So to figure out what 9.5% is, my example here says, let's say you earn $30,000 a year. 9.5% of that is $2,850. So that works out to $54.81 a week. So the city has to offer you a plan that's good enough with a deduction that's not more than that. And hopefully, you're all already in that situation or better. I know the coverage is better. And in the regulations, the cost of family coverage does not get taken into account at all. So families, the affordable coverage for families kind of just slipped away when they rewrote the regulations from the law. And that's just one of the things that happened. So that's a bunch about what the employers are required to do. It brings us back to the question of, can you get a subsidy? One of the questions we're getting a lot is some employees say, yeah, well, the health plan here is fine, but I think I want to go on the exchange and get a health plan there. In New Hampshire, I think if you look at the plans they're selling on the exchange, you'll want to stay with your city-provided coverage. But that might not stop you from being curious. So first, anybody who's a US citizen can buy coverage on the exchange. So if you want to go get coverage on the exchange, look up their website or give them a call. You can do it. Now, the catch is going to be if your employer meets the employer responsibility requirements, i.e. they offer you a good enough plan that's affordable, that's going to prevent you from getting a subsidy. If you're able to get a good plan at your employer and it's affordable, the government doesn't want to pay to subsidize you in the exchange. So, we get a bunch of calls from people in town saying, I keep going in the exchange, but something's wrong. I can't figure out what my subsidy is. Well, actually, they are figuring out what their subsidy is. They just don't believe it could be zero. Because their income level is low enough, they think they should qualify. But if you have good coverage, you won't qualify for a subsidy. And also, your family members won't as well. So that's a key thing to know. On the other hand, if you don't have affordable coverage at work, the odds are very, very good that you will qualify for a subsidy and you will want to look into it. So if you're a part-time employee, or if we're really talking about your brother, or whatever it is, there are a lot of subsidies available. And again, for family of 4, it's up to about $96,000 of annual income. So a lot of people follow this. So next, where does all the money in health insurance go? The premiums are pretty high. What's driving this? Well, this bar here is the administrative costs for our health insurance program. And this one here is those Affordable Care Act taxes I was talking about, because they don't include the 2.5% for us. And this box here is margin that we put in the rates to allow for fluctuation in case claims jump a year or something. And the big blue piece of pie, is health claims. It's payments to hospitals, doctors, pharmacies for drugs, diagnostic tests, mental health care. It's all the care for you guys, and those are the checks that go out to pay for that. So almost all the money, over 90% of the money, goes directly to pay for healthcare costs. So we work hard to be more efficient and hold costs down at the trust, but there's only so much we can do squeezing this piece. It's just not that big a total. So anything we do on healthcare, what the actual claims are, that healthcare that you guys and your families get, is where the money really is in the whole system. Anything we look at, how to improve the system, that's where we're going to look first. And we also have to look at how is health insurance rated. Well, health insurance is rated on something we call experience rated. We look at the city's rate, how much money they paid in premium for the whole year, and then we compare that to the health claims for the whole year. And if the health claims are pretty much what we expected, there's going to be a modest increase in the rates. If the claims grow larger, they're more than we expect, that's what makes the rates go up faster. And if the claims come down, you either get a flat increase, or in some cases, you even get a reduction in rates if your claims are reduced. So, you know, sometimes with car insurance, people don't have claims for a long period of time, and so when they do go get something repaired, I know some people are like, I want to get as much out of this as I can. Well, if we do that with our health insurance, what we're doing is we drive up our claims, increases costs for everybody, and our rates go up more next year. So we have an incentive to want to hold costs down in health insurance. These are the parts that drive an increase. So first, in an increase, the first chunk of it is price inflation, i.e. hospitals had to raise their prices. That's part of the increase. But as you can see, it's not most of the increase. Increased utilization, people getting more care. You've probably seen billboards, radio ads, so forth for various hospitals and other medical centers. They're trying to increase utilization. People find out about new things. Technology, if you know anybody with hepatitis C, they should go see their doctor. There is this cool new drug. I hope they're not on our health plan. But there is this cool new drug. We do cover it. And hepatitis C is a bad liver disease. And there hasn't been a good way to cure it. There were a few sort of treatments. They had horrible side effects, and they had a so-so success rate. Well, now there's a drug out there. You take one pill a day for like 85 days, and it has like a 95% cure rate and almost no side effects. It's pretty much the perfect medical breakthrough. And if you know somebody with hepatitis C, they should go talk to their doctor about it. What could be wrong with such a miracle cure like this? Anybody want to guess what one of those pills costs? $1,000 a pill, and you need 85 of them. So, it's a miracle cure. If you have hepatitis C, this is the best news ever to come along. If you're an insurance company, you're kind of staring at this like, if everybody in the country with hepatitis C went and got treated this year, and they're rushing to get treated, it would cost an extra $240 billion, and we only spend $265 billion on all the other drugs combined. So I'm hoping the technology stays at the 1% shown here. Cost shifting, the federal government underfunds Medicare and Medicaid. They pay less than they're supposed to. And they send the doctors, and ask your doctor about this, you'll really get them going. So doctors and hospitals turn around and charge you and your health insurance more to make up for that. So it's kind of a hidden tax. Congress has gotten away with it a long time. They're addicted to it. They underfund the plans. We make up the difference. And leveraging, if you have a copay that's fixed at $20 and doesn't go up, as the costs go up, you keep paying $20, but the health plan pays a higher and higher percentage of the total. So the health plan's costs are leveraged, and it drives the increase in the premium. So those are the parts that drive the trend in health insurance up. There's a bunch of different pieces to it. But of course, the big one always comes back to the claims. So let's go look at the Cadillac tax, because these things all tie together. The Cadillac tax begins in 2018. Because they haven't written regulations for it, there's a lot of things we don't know yet, but we'll cover the things we do know. First, it is a 40% excise tax. 40%. And we thought Massachusetts having a 5% sales tax was bad. It starts January 2018, and it's an amounts above a high cost limit. So it's not every dollar of the health plan, it's an amounts over a certain amount. What's included in it first? The full amount of the premium. It doesn't matter if you pay the premium or the city pays a premium, the total premium is subject to the tax. Your health plan, flexible spending accounts, health savings accounts, health reimbursements account, HSA, HRA, they all get rolled up in it. A few things don't. Things like disability insurance, dental insurance, vision insurance, they're not part of it. But anything that smells like health insurance or anything that pays a deductible for you for health insurance will be part of what gets taxed. So, the tax is paid on amounts. If you're a single plan, in any amount over $10,200, or a family plan, anything over $27,500. So, I looked, your plans aren't there yet, but we have 4 years of inflation, and the odds are reasonably good you'll be there if nothing is done. And a 40% tax is a bad use of resources. So if you imagine if the plan costs $11,200, it'd be $1,000 over the line, you'd have to pay a $400 tax on that.
Can you say that again, please?
Okay, so the limit is $10,200. So if the plan in 2018 costs $11,200, i.e. $1,000 more than limit, the part that's taxed is the amount over the $10,200. So if you're $1,000 over, you pay an extra $400 of tax because 400 is 40% of 1,000.
Who is you, the employer or the employee?
Well, it would either get collected by the insurer or the employer, depending on several different circumstances. But I think it's a very safe bet that any insurance company is going to pass any 40% tax on as part of the premium. If the premiums go up here, who pays a tax like this? That's a fascinating question that needs to be decided locally. But a 40% tax that nobody really benefits from here is a bad use of resources. So.
What's the purpose of this tax?
Well, there's two purposes. The simple purpose is health reform is expensive, so you need some taxes to collect money to pay for it. But the real driving force behind it is the people passing the law feel that when health insurance became employer paid and tax deductible was really at World War II, because you couldn't raise salaries then. There were wage controls. And in the early 70s, when Nixon put wage controls on, are the two times when health insurance really grew. And it's tax deductible, so it encourages people to fund money through it when it might be better used other ways in the economy. This is the opinion of the people passing the law. So they want you to stop spending so much for health insurance and have the money come back into the taxable part of the economy. And also, there's a problem in health insurance that if you aren't responsible for any of the costs, you don't pay attention or care about how the money's spent. And if you're American, you don't want to worry about where the money goes in health insurance. You don't want to worry about where you go for health care or what it costs. And that would just define you as a normal American. So the idea is it's going to kind of force people to put more deductibles and other things on plans so that employees are more involved in the process. And I expect with groups like yours that not to be a popular option. But Rahm Emanuel was the chief of staff for the president for his first term. And I can't quite think of his brother's name, but it's Rahm Emanuel's brother who was responsible for writing this stuff. And about a month ago, he had an article in the Wall Street Journal where he laid out how and why they did this. You can look that up if you want. Now, it might get adjusted a little bit for inflation or for a high age sex mix. I've been watching the inflation thing. That doesn't look likely. We don't have the tables for how they would do an age sex mix. But if they do it, you'd probably benefit because cities have a higher average age of employees than the general population. Also, if an employer is a majority dangerous professions, which are things like coal miners and people who string wires on high towers, and public safety officers, so police officers, firefighters, EMTs, if the majority of the group, then you get a little higher limit. It goes up to $11,850 single and a little higher in the family. But healthcare reform turns out to have a couple of unintended consequences, at least from our perspective. And it makes you wonder, what can we do about this? Well, the city's concerned about this, we're concerned about this, and I'm sure you guys don't want to pay a tax. So we've been looking at what can be done. And essentially you end up with two choices. One is to pay the tax, or the other is to find a way to lower premiums. But there's a lot of problems lowering premiums. The challenge is, first, we have an aging workforce. As you get older, you use more health care. And it's hard to stop aging. Retirees have to be covered on the state plan, on the city's plan, and as part of it's at the same price. And that drives up costs dramatically in the plan. But there's a state law saying we have to do that. There's a lack of competition in healthcare. It's not like in the Keene area, you have a choice of a lot of hospitals to go to. Unhealthy lifestyles. America doesn't encourage the healthiest lifestyle. The American diet, you know, probably the most dangerous part of town is when you drive down that strip, there's Burger King and McDonald's, and we have very generous benefits, but I'm betting you don't really want to change those too much. And we have employee expectations. A lot of you took these type of jobs to get good benefits. There's labor agreements saying you're entitled to them. These are all challenges to what we could do about it. So as you look at how are we going to handle this, what are the choices? The easiest choice to deal with is, can we look at this unhealthy lifestyles? Can we look at making ourselves healthier and reducing claims costs so we keep ourselves below this line? So I'm going to suggest that the best solution to this problem would be lowering plan costs through wellness. And not only is it good to be healthier because it costs less from the claims side and the health insurance side, but being healthier has lots of good benefits in your daily life, like you feel better. So I'm going to turn it over to Meredith, and she's going to talk a little bit about what wellness is and what's available to you.
So then enter Meredith, the wellness coordinator for the trust. I see a few familiar faces. We've done a couple different educational sessions here for the city, and we'd like to maybe do a little bit more, but I'm here to talk about some of the benefits that we currently offer you as employees and that you're eligible for right now. So why wellness now? I think Rick just summed it up. It's something that we need to start planning for the future. Start now, prevent now, will help in the long run. So here at the Trust, we provide wellness services to you at no additional cost. It's part of your health insurance plans. If there are any activities, which I'll get into in a little bit, that you're interested in doing, please contact me and I'll have my information available as well. And we're here to help you, whether it's in the pre-stages, so finding some screenings, doing some education. Here's my next slide. So doing some screenings, doing some education, help you practice some of the things that you may be hearing. A lot of you may hear commercials now, or see commercials now for fruits and vegetables, trying to get more servings in the day. If you have questions about how many you should be eating, we can help you answer that. And we can also design challenges to help you practice those tasks as well, where we can do, we have a wellness challenge that consists of healthy eating, activity, stress management. You can practice those techniques, and we have challenges we have rewards that are tied to those challenges as well. So we make it fun and engaging while still helping you every step of the way. We also have the Employee Assistance Program. How many people have heard of the EAP? Almost everyone, awesome. So now actually with the EAP, we've done a pilot program for the city of Keene. That's an expanded EAP. And what the expanded part means is it's starting already. It started April 1st, and here I am talking to you about it right now. It includes those educational sessions that you may have had. I think Mary came in and did stress management or breathing. See a couple heads nodding that people attended those. They can do a variety of different wellness education topics. But what the EAP also does is they provide legal and financial services for you. So if you call the EAP, you need a will looked at, they'll be able to do a 30-minute free consultation for you for that will. And then if you have another event, say a different will or another document, they also do another free 30-minute consultation, and then pay is on a adjusted scale rate after that. In addition to that, the expanded part now offers 3 face-to-face consultations. So if you're having maybe a stressful day, maybe carrying over into your family life, and you need someone to talk with, you'll have 3 at no cost to you face-to-face consultations with a master's level consultant. We set 3 face-to-face sessions because they say that 90%, I believe 90% of all consultations will be resolved in 1 or 2, and if not that 3rd face-to-face. So we provided those 3 free to you. So no cost out of pocket. If you need more sessions beyond those 3 face-to-face, they will refer someone to you in the Harvard Pilgrim Network, so it'll be right alongside with your health plan. And I think that's, I have some materials for you as well for the EAP if you're interested with the phone number. They also have an online portal as well. So you can go right onto their website. They have everything tabbed across. They have wellness, they have financial, legal, consultations as well, mental health, stress management, and you can use their website, and you can also call the toll-free number as well. We also have CBI. Anyone familiar with CBI, Concepts and Benefits? A couple of people. They're the ones who administer your FSA and HRA. So to start today, HRA, your attendance today is the first step towards having that extra $250 put into your HRA. So awesome for that. We will have a sign-out sheet at the exits. Make sure you put your name on the sign-out sheet. Yes, Vicki?
I just wondered if you want to explain HRA and FSA for people who aren't familiar with acronyms.
Sure. HRA is your health reimbursement account, so that by attending this here today and doing one other activity, which would be either the PCP, the primary care visit, the 4-week logging your physical activity, the smoking cessation class, which I'll be doing this afternoon at 4 o'clock for 4 weeks, and then I'm missing one more. Tour, yes, thank you. The Hanford store tour. By participating in that second activity, one of those 4, you'll have that $250 put into your HRA. Where your FSA, your flexible spending account, and I have some materials on that for you, where I can get them for you. Flexible spending account, can you help me out, Rick, the difference between the two? Flexible spending is you the employee, puts money into the flexible spending account, whereas the HRA is the employer is putting the money into the account. Does that make sense for everyone? Okay, great. And if you have more questions about that, let me know and I can get the information for you. We also have Save On program here offered for the city of Keene. Has anyone heard of Save On? A couple people, great. So Save On is a benefit offered through Harvard Pilgrim, offered by us, the trust, that helps people become better healthcare consumers. In fact, that if you're going out to have a mammogram done, most people don't know what the typical cost of a mammogram may be, or some lab work, some blood work. If you're going for your primary care visit for your annual physical, some of your lab work may cost $15, $20. Some of it, depending on where you go, may cost $100, $150 depending on the location. So what Save On does, it's a program that you voluntarily call. So if you have a scheduled mammogram, colonoscopy, bone density screening, lab work, MRI, CT scan, if you have any scheduled services like that, you can call Save On, say I have this procedure scheduled at X hospital. Could you tell me if there's another low-costing provider available? And they'll be able to tell you if you'll be able to save money for yourself or for your health insurance, for your employer on that premium. If there's another low-costing provider available in your radius that you can go to help you save money. It's a voluntary. You call. If there's no one available, you're already at the lowest costing provider, you get a reward. I believe it's a $10 incentive for just calling and you're already scheduled at the low costing provider. If you're requested or if you're suggested to go to another facility in your area because the cost is a little bit lower, you have the option, first of all, you have the option to move. You can stay where you are, or you can move to the new facility where the scheduled or where the nurse for Save On would schedule your appointment, would transfer all of your paperwork, take care of all the legwork for you. So all you have to do is call, say, yes, I'd like to move to the low costing provider. Please schedule me there. They schedule it, you show up, it's less expensive, less money out of your pocket, less money out of the city's pocket for the cost of that service. If you're, depending on which procedure that you're having, if it's lab work or MRI, there's price differences, there's also tier levels, and how much money you save the plan, you will also be able to earn an incentive for that as well. And those are a tier. I believe it's $10, $25, $75, depending on how much you save and what procedure you're having done. Harvard Pilgrim also has a fitness reimbursement, which is different from your wellness reimbursement, and I'll talk about that. So Harvard Pilgrim's fitness reimbursement is for $150 per family, for family plan, and that's up to $150. So if you go to the local, I'm not sure, is there a Planet Fitness around here? Planet Fitness, no. So if you go to the local gym and it's, say, $10 a month, for 12 months, that's $125. You can apply to have the $125 reimbursed by Harvard Pilgrim at the end of the year. So no costs out of your pocket for your gym membership. If it's a $300 membership, then you'll get $150 for that. And there are stipulations of what constitutes as a gym or a facility. It has to have weight machines, has to have at least 2 weight machines, has to have free weights and cardio equipment, and you have to pay either monthly, quarterly, or annual dues. It's all listed right on the Harvard Pilgrim website. You can also apply for that right on the website as well. It's very easy. It took me about maybe 30 seconds. I already had my account set up through Harvard Pilgrim, so my online account there. Logged in with my username and password and went to fitness reimbursement, put in my location of my gym, put in the cost, and hit submit, and I received a check. I believe it was 4 or 6 weeks later on for the difference, or for the cost of my membership. Yes.
Is that linked to the health questionnaire that you have to do?
The health questionnaire is separate. It's on the same website. It's through Harvard Pilgrim, but you do not have to complete the health questionnaire for the fitness reimbursement.
Or for the glass reimbursement?
For the glasses and the wellness, yes, you have to do the health questionnaire. The health questionnaire is separate from the fitness. Harvard Pilgrim does the fitness, whereas the trust does the wellness and the eyewear, which I will be getting to the next slide. Harvard Pilgrim also offers a number of wellness savings opportunities. So in addition to the eyewear that we were just talking about, they also have discounts ranging from, I believe it's 25 to 35% off of eyewear, accessories, things like that at specific locations. I have a list or a booklet if you need to look at that. It's also all listed right on their webpage by category, by amount, by location. So eyewear and ears, so hearing aids, eyeglasses, they have discounts. Fitness, they also, in addition to the fitness reimbursement, some gym memberships, they have to qualify through Harvard Pilgrim. They have discounted rates, so if there's a local, I believe there is a local, I can't remember the name of it, but it's like a 20% off of your annual dues for the local fitness facility. Athletics, if you want to travel to Manchester, Runner's Alley is one of their participants. They're the only one, I believe, in New Hampshire, and they have running shoes there, and you can get, I believe it's 15 to 20% off of your running shoes or walking shoes at that location. There are a few more in Massachusetts, so if you're traveling, making a trip to Boston area, you'd be able to maybe stop in there too for athletic shoes or athletic wear. And also equipment too. There's a place in Portland, Maine that sells exercise equipment, so if you're looking for a home gym or piece of equipment, they offer discounts as well. Alternative medicine, so that would be your acupuncture, chiropractics. They offer % discounts at select facilities who are in the Harvard Pilgrim network. Nutritionists, so if you're want to meet with a nutritionist, select nutritionists in the area also have discounted or participated in this wellness program. Safety and comfort products for diabetics, socks, sleeves, compression equipment, those would all be have a discount attached to them as well. Elder care, and there are many more. And again, I have the list. If you're interested, I can let you take a peek at that, or it's right on their website. So the New Hampshire Interlocal Trust does wellness reimbursements, which is what we were just speaking about, the eyewear. All members, all family members who are covered on the plan are eligible for up to $200 in eyeglass reimbursement. We do request that you complete your Harvard Pilgrim Health Questionnaire, which is also on the Harvard Pilgrim website before submitting or with submitting for your eyewear. We do ask that there be a receipt attached to it, an itemized receipt, so we can see if it was for the exam or for the eyeglasses, because it's the eyeglasses that we'll reimburse for. And then we also offer wellness class reimbursement for adults and for children. Adults have $250, and when I say adults, that's the subscriber and spouse. Adult children would still fall under the children category, so if you have dependent who's 20 years old, they would still be considered a child. And they would be eligible for $125 wellness reimbursements. And those are classes such as Zumba classes, swim lessons. I think we've seen a couple for hockey lessons or skating lessons recently throughout this winter. I've seen one for horseback riding classes as well. So anything along those lines. If you have a question, if it qualifies, just give us a call at the trust and we can search that out for you. So wellness programs, this is kind of where we started. We've done a number of education sessions here. Actually, anyone in the fire, go to Brittany's Nutrition 101 with a cooking demonstration. She brought in some food for people and they did a little cooking thing. So if you're interested in doing a little cooking demonstration or having a fitness class or stress management, we're here to either provide that ourselves or have Mary from the EAP be able to come in and provide those services for you as well. Did anyone participate in the Walk New Hampshire Challenge last summer? Oh, awesome. We're going to be doing that again. Last year we did it in July. This year I think we're going to try for June. How does June sound for everyone? Is there a difference? June or July? Everyone good? All right, good. So I think we're going to try to do it in June, just so we can get it going a little bit earlier in the summer so it's not as hot. We had a couple people say it was really hot towards the end of July and the beginning of August. So we're going to do another Walk New Hampshire challenge, but we can also create individual challenges for different departments or against departments. So if you want to challenge, the library wants to challenge the city hall, we can set up a challenge for you guys to do either walking, stress management, nutrition, hydration. If you have something else in mind, we can create it for you. We customize all of our wellness programs. We want to really give you guys we want your feedback, we want your ideas, and then we can create and provide the tools that you'll need for the challenge, really. We've also done, I know, a number of years, the health fair here as well. We're always a vendor. We provide the flu shots and the biometric screenings. We're the sponsor for those. So make sure you're attending that every single year. It's a free opportunity to receive that flu shot and biometric screenings for you. And then we also have this thing called the Trust Bucks program, which we piloted it with a police department, and they were looking for new fitness equipment for their fitness facility. So they wanted a lot of equipment, so we created this long-term wellness program that had education sessions, challenges, physical activities. So if they were running road races, they could get points, or if they were playing pickup basketball, this was mostly in the summertime for them. PCP visits, different or other educational sessions. So we put those all into a long-term program, I believe it was a 6-month program. And based off of their participation, we rewarded them as a whole, not individuals. We rewarded the work site based on their participation in the entire program. So we were able to provide a number of pieces of equipment for their fitness facility because they had such great participation in all of the challenges that they had helped us create for them as well. So if there's anything that you might be interested in for your work site or for the city as a whole, please let us know. Please let Vicki or myself know, and we can help design a program for you. And then just a quick little demonstration for you all. We've done a couple on the healthy eating, like the nutrition, the demo that the fire had participated in. And so I just want everyone to sit in their seats, straight up, feet flat on the floor. This is a nice relaxing one, helps you clear your mind out. So if you put your left hand on your belly and your right hand on your chest, make sure your shoulders are nice and relaxed. You can close your eyes, I usually do, helps me relax. Just take a couple of breaths, in and out. Deep breaths. And notice which hand is moving more. If your hand on your chest is moving more, or if your hand on your belly is moving more. Ideally, you'd like the hand on the belly to expand more and more. And it takes a lot of practice because a lot of people are chest breathers. So now try to focus your breath to go through your belly. So almost like you're pushing your stomach out and then letting it out and letting that belly go back in. By doing some of these breaths and concentrating on them coming in and out helps you be in the moment, helps you. I'm not a huge holistic person, so I'm not here to preach about holistics, but taking those few breaths in and few breaths out helps you calm down, kind of forget your surroundings. It's a little bit easier to focus when you return. So take a couple minutes if you're having a stressful time and you just need a little bit of a break, 30 seconds or so. Put your hand, you don't even have to put your hand, but if you practice that belly breathing, pushing that stomach in and out 3-5 times for 30 seconds, it really helps you focus. So something that you can take back to the work site. We have a number of education sessions that build on those kinds of things, and yeah, so that's about it. Does anyone have any questions for us about the wellness or for Rick on health insurance? Yes.
Does your fitness membership of the gym have to run from January 1 to December?
That one I believe is a January 1 to December, yes. That one, you have to be a member for at least 4 months. So if you are just a 3-month user, you won't be eligible to submit. But say,
March of this year to March of last year to March of this year.
so you'll be able to do March to December.
Okay.
And you'll be able to submit that amount, and you'll be able to actually write on the website, you can put in your monthly amount, so you'll start March and then go through December and tell them how much money you paid for each month. I recommend doing it that way for the March to December, or doing the full year, because you can only submit once for the fitness reimbursement, whereas the wellness you can do multiple times. Fitness you can only do once in a year, and you have up until March of the previous year. So if you started January 1st of this year, went all the way to December 1st of this year, you would have up until March of 2015 to be able to submit for that entire year.
Does that hold true for the March to December, March to March? I mean, March to December, I want March to apply.
Correct.
Okay.
Yep. So you have a 3-month window after just December 30th to December 31st to do that. Yep. Anybody else have any other questions about wellness or health insurance? No? All right. Well, I will have a piece of paper on the top top desk out there before you leave. Make sure you write your name legibly so I can make sure you have credit, or you already did it. Great. So if you snuck in afterwards, just make sure your name's on the list, and we'll give you credit for being here today, and have a good good morning. It's still morning time.